Thanks. Well, welcome everyone to the April Lunch and Learn. We thought it would be appropriate given the fact that we're now about 2 years since the start of the pandemic to have kind of an update from the perspective, a health perspective. And so it's my pleasure to welcome Vickie Folse and Melissa Graven. Both are with the Illinois Wesleyan School of Nursing and in our Arnold Health Services area. So Vickie, Melissa, I'll turn it over to you. Thanks for being here.
Carl, thank you for the introduction. We're laughing over here because of the technical difficulties. We are going to model for you the absence of physical distancing and mask wearing. But we thought this was an emergency situation that warranted. So as Carl said, I'm Dr. Vickie Folse, and I'm delighted to be joined by my colleague, Melissa Graven. What's important for you to understand is when the pandemic began, Melissa was with the McLean County Health Department, and we promised her a better life at Illinois Wesleyan University. And so she came to be one of our colleagues. And as each of you have experienced the last 2 years in the same way that we have, there's been nothing quiet about her transition from being a member of the health department to a member of the COVID team on a small private residential liberal arts campus that had some of its own unique challenges. So I'm going to share my screen with you, and Melissa and I hope to engage you in dialogue. We'd like to make this as informal as possible. And so you'll notice that our lessons learned slides just have a few words on them. We invite you to put some comments in the chat, in the Q&A section, or our museum staff host, Tori, has stated that she'll unmute you if you raise your hand in our presentation. So let me begin with a screen share. Melissa, do you have anything to add before we get started?
No, I think you covered that quite well.
Okay. So Carl did a nice job with our introduction. Our charge today is to talk about the past 2 years with an emphasis on where we go from here. So vaccines are working in exactly the way they were developed. Vaccines are intended to prevent severe illness and death. And so we want to talk a little bit about how critical vaccines have been in the fight against COVID. Melissa, you want to talk about this slide? And
yeah, I think sometimes it gets lost in some of the discussions about the effectiveness of vaccines. And in the very early onset of the pandemic, of course, there was rushes and lots of spotlight put on to getting vaccines developed and deployed with the overall goal to be saving lives, not necessarily preventing disease transmission, but making sure we cause less burden on our healthcare systems through severe illness that lead to hospitalizations and deaths. I think it's a wonder to the vaccine that was developed that it is an effective vaccine at preventing transmission. Some people think 80 or 90% effectiveness isn't high, but when you look at a lot of our other vaccines that we have currently, MMR vaccine, that's high 70s, 80s, but because we have such a highly vaccinated population, it works. So this has been a great vaccine, and I wanted to kind of demonstrate in this slide here with this graph that shows U.S. COVID-19 deaths with and without vaccines. I realize it's kind of a compressed slide, and I thought I updated to include the link to the article where you could see it cited. But the top slide basically is showing you pre-Omicron. We need to make that caveat because that kind of changed the game of COVID-19 deaths when the vaccine was developed there. And if you can see on that slide with the blue arrow, the decrease that they had in deaths when we started implementing vaccines. The bottom slide is a comparison of actual death toll to an estimate of the lives that would have been lost. So it's kind of projecting out. And if you can see that bump, if we did not have the vaccines at that time, those are the deaths that we would have seen. So it's a good visual of, because unfortunately we're all visual, we hear numbers, we hear data, we hear percentages, but when you look at that stark contrast and that big epi curve that you see there, the lives, those aren't just numbers, those are lives that were saved with the introduction of the COVID-19 vaccine.
So I'm going to offer some insight into decisions we made at Illinois Wesleyan that will help you understand the complexity of vaccines. We made a decision once there was approval for J&J, Moderna, and Pfizer's vaccine, not emergency authorization use, but once approval was granted, assuring that the vaccine efficacy and safety were peer reviewed and confirmed in many populations, we decided to mandate the vaccine at Illinois Wesleyan for students. And our vaccination rate was 97%. And so it's really important to keep in mind, we did offer the ability for a student to request either medical or religious exemption. And that final number was just a little north of 50 students. So we had significant buy-in, which allowed us as a campus community to stay in person, to continue to offer classes face-to-face. And not that there's been anything normal about this pandemic, but to really preserve the collegiate experience that students longed for. What we did with our employees is we followed some statewide mandates, and both our employees and our students who were not vaccinated were required to surveillance test weekly. And we'll talk about that in a future slide. But we felt so confident as a campus community about the importance of vaccines. We wanted to make sure that those of you who are attending this webinar ask us questions as we go forward about issues with safety. And we're going to come back toward the end of our presentation talking about how messaging has changed and how challenging it's been as we've added boosters and second boosters and everything, how hard it is to keep up with this process. So anything, Melissa,
Nope.
before we go to our second lesson learned? Okay. And again, those of you joining us, feel free to stop us at any time. So lesson 2 for us, masks prevent the spread of illness. So as noted, Melissa and I are sitting here unmasked. That's not normal for us. One of the things that we learned early on is how politicized masks became. So we require masks throughout this pandemic on Illinois Wesleyan's campus. And it was only 2 weeks ago, after students returned from spring break and participated in post-spring break surveillance testing, if they were symptomatic or unvaccinated, that we went partially mask optional on our campus. And what that means for us is when we're in a setting in which we're required to be, a classroom, for example, we still require that students wear properly fitted masks. We have the availability to offer KN95s or N95s for students who require them. But as each of you did throughout the pandemic, we went from cloth masks, we debated issues of gaiters, we had, students and employees not wearing their mask properly, just sitting beneath their nose. We had student athletes who were stating they were wearing masks, but they were wearing them under their chins while they were actively involved in their collegiate level sport. So masks were really a hot button topic on our campus. And I suspect many of you saw that in the community.
Mm-hmm. Yeah, and I think just to speak a little bit to masks, as Vickie communicated earlier about the dissemination of information and communication, with masks being politicized, there was a lot of changing science with masks when COVID first came on the scene and the availability of masks. At the time, we didn't have a surplus of N95s and surgical masks that we could recommend to the general public. That's changed now. Supply chain has certainly caught up to the demand. So cloth mask is definitely better than nothing, but yes, a surgical mask is going to give you better protection than a cloth mask. And we can make that recommendation for the general public now because we have them available to everybody. Initially, the resources were really being allocated to those frontline workers that were working with COVID positive patients in the healthcare setting, our first responders in the field, who are responding to 911 calls, or police officers pulling people over with hacking coughs. We wanted to make sure that they had the resource they need to be safe in their job as well. So it certainly demonstrated the scientific process in real time and how that can be challenging to communicate those updates and changing science to the community.
Mm-hmm. And you'll see again later, we're going to talk about politics and we're going to talk about communication. And one of the lessons learned was how essential it is to be united in messaging. And I think that's one of our failures as a nation, in which, you would receive a communication. I'll use the CDC as an example, that stated masks were unnecessary. And then it was followed with how essential masks are in the prevention of spread of illness. And I think, back to the early days, we thought surface transmission was a problem. And so we were, we at the university had hired porters who were going around and using aerosolized disinfectants throughout the university. And again, as the science evolved, we had to make some modifications, but it really left behind a very distrusting public. So our third lesson learned is about testing. So I'm going to again use an Illinois Wesleyan example. We decided that we would conduct baseline testing regardless of vaccine status. And so when we would leave for the semester, we'd have a period of time away from the campus. We wanted everybody to come back, and we were very insistent on non-rapid PCR tests. So we consider them the gold standard. It was challenging, to say the least, in terms of the manpower to process, 1,600 baseline tests for returning students. We found that to be a critical tool in our arsenal of fighting COVID. We offer weekly surveillance tests on campus. So we've minimized the barriers that an individual might experience. We do non-rapid PCRs on campus, and a student or an employee simply has to walk into our athletic facility and be swabbed, and then we control the messaging. One of the things we saw throughout COVID is how overrun the needs were at our state and regional level. And so at Illinois Wesleyan, we did our own contact tracing, we did our own reporting, and that was really helpful for our student and employee population, but exhausting. Like I was saying before we started this, I promised Melissa a better life, and there were times in which it was not. And so surveillance testing was critical, and we continue to have as a first action any student who is experiencing cold-like symptoms. They might be able to conclude their allergies, their sinus infection starting. We have them test. We have evolved to being more reliant on rapids for our symptomatic individuals. But that when we talk about reporting and the fact that it looks like our numbers are really down in McLean County, one of the challenges is so many people are using rapid tests. They don't go into the state and national database in the same way. And so there is a mystery right now in terms of the actual incidence and prevalence of COVID, particularly with this Omicron variant. So Melissa, what would you like to add about testing?
Yeah, kind of along the lines of that in terms of numbers and testing is in public health speak that hospitalizations and deaths are lagging indicators of disease prevalence in your community. So when you start to see your hospitalizations and deaths go up, you're already behind the curve. So testing, early testing, identification, and contact tracing are key. And the prevalence of the disease in your community coupled with we'll talk to the caseload that you have in your community, but then the hospitalization and death really speak to the severity of the disease in your community. So testing is such a critical piece of a multi-layered approach of COVID in your community.
Mm-hmm. If any of you live with 17-year-olds, you'll understand what a challenge contact tracing became at Illinois Wesleyan University. So if I test positive for COVID and I'm asked for one of the healthcare providers in our health services, tell me, with whom did you spend more than 15 minutes in a distance less than 6 feet, regardless of whether or not you were wearing masks? It's amazing how many students initially said, no one. Mm-hmm. And yet they had a roommate, they had a significant other, they participated in a sports team. And so I would say that we would learn, for example, of an off-campus social event, and we'll say, did you happen to be at Killarney's on Friday night? Were you at such and such a place? And so it was really helpful to have embedded contact tracers who had a sense of what was happening. In contrast, if local public health departments are doing contact tracing, they're at the mercy of the person on the phone to either disclose or not disclose. One of the most effective policies we made as a university is stating that if you were fully vaccinated, and I'll come back to up to date, but if you were fully vaccinated, you were exempt from quarantine. And that at that moment, we had tremendous buy-in from students giving us the names of other humans that needed to be tested or may needed follow-up. So some of the contact tracing, isolation, and quarantine were essential to assure that we could meet the needs of our campus population. And then, of course, came the specific challenges with where to place somebody when they were in isolation. What happens in terms of quarantine? So lots of logistical challenges. And if a student, for example, went home, they might place their entire family at greater risk. And so that science evolved as well in terms of who should not be around a COVID positive individual. And we spent a lot of time communicating, probably weekly, with how our policies were changing.
And contact tracing really is a hallmark public health intervention that's been done for decades, if not over 100 years. We primarily would see that in relation most heavily in your local health departments related to STI, sexually transmitted infections. But also, I don't know if anybody remembers the mumps outbreaks we had here a few years ago. I was in the CD section when we had those, and contact tracing really helped identify susceptible contacts so that we could do early interventions and quarantines and isolations. It really is a skill that a lot of the DIS at the disease intervention specialists at your local health departments go through. But I will say, having worked contact tracing both at the public health level and at Wesleyan, it's subject matter experts in your facility at your place is critical. I know we would investigate Wesleyan students at the health department, and it's a different world. Knowing the makeup of the campus and the connections and who you can resource. So I think that also opened the public health, the local health department's eyes of how you need to get buy-in from your community organizations to broaden your umbrella of who can contact trace and who should, and how to share that partnership to be more effective. So I know we collaborated a lot with ISU and Wesleyan, and I think the better for it, and really will change what contact tracing looks like in the future.
Yeah, a lesson learned.
A lesson learned, yeah.
The other thing I'll add is, as a university, we adopted a universal period of time. So you recall in recommendations made by entities like CDC, Illinois Department of Public Health, even American College Health Association, you could get credit earned for symptoms that you had. Your get out of jail free card came pretty quickly. We learned that students got pretty resourceful, and they were already trying to have completed their isolation before they had any contact with us. So we simply adopted a 10-day isolation and quarantine policy, regardless of the onset of reported symptoms, with day 0 being that day of testing. When the guidelines changed, we were slow to adopt a 5-day reassess, 5 days of strict mask wearing, because we were concerned on our small campus about adherence. When we did finally make that decision, we had adequate masks that we could give to students. We really put our infrastructure in place before we communicated a change. And that certainly is an important lesson in terms of making those decisions. This one's a big one in terms of leadership is essential in a pandemic. This is where politics came into play. It's where we saw inconsistencies in what was communicated between different organizations. And this was a failure on so many levels in terms of, with Tony Fauci eventually becoming the face of COVID. He already was politicized before he was ever elevated into that important role. And so hopefully at the places in which you work, or the places in which you interacted, there was a clear voice and a clear sense of leadership. We were successful on this campus because we took in different voices. We had student voices, we had infectious disease voices, we pulled together faculty and staff and students in a way that the decisions we made were clearly data-driven, often unpopular, but unwavering.
Yeah, I can't underscore the leadership in a pandemic like that. It like this is just paramount. It really took a lot of people by surprise. Looking at, like, when the pandemic hit, I was at the health department and seeing just the simple question of jurisdictionality in terms of who's going to run this, who's in charge of this, and not to say there was anything that there was poor planning. It was just a pandemic on a level we had never planned for in this capacity. We ran drills, emergency preparedness constantly, but it was always in the context of a flu or anthrax or Ebola. Ebola was one we practiced quite a bit. So this, I think there was a lot of lessons learned here. A lot of partnerships and leadership roles were looked at. And I have to say, coming to Wesleyan, there definitely was a concise leadership and unity from everybody involved in terms of messaging and what the directions and guidelines and policies were going to be.
Yeah, which is a perfect segue into lesson number 6. Communication and messaging cannot be overlooked. This may surprise you, as I referenced that 17-year-old student earlier. Many of our students didn't read our emails. They were beautifully crafted, and we tried to make sure things were clear. And it took us a little while to understand that parents and guardians were tremendous assets. They would read the emails if we would simply make them available to the parents. And so we attempted to communicate with great frequency. And we, as Melissa mentioned, we would embed links into scientific articles, and we would put up Q&As. We had frequently asked questions. because we truly had frequently asked questions. And so always making data-driven choices. And as I said, we had to learn with not being popular, learn to not expect that, because we were in a pandemic and because our objective was to assure the health of our entire campus community. It got ugly at times. So if we had to, for example, tell a student athlete that they were unable to compete or participate in practice, we would hear from that student athlete's family about how we were robbing them of the opportunity that brought them to Illinois Wesleyan in the first place. And so those calls Carl would take some calls, the president would take some calls, we would take some calls, board of trustee members would take calls. So that messaging, again, had to be crystal clear and attend to the reality that they were going to be unhappy members of our campus community.
And communicating clearly and messaging clearly in the age of social media just adds another challenge. It's always been difficult to communicate in a manner that everybody can understand science and health information. But now we've got terms like SARS-CoV-2 and PCR. Everybody knows what a PCR is now. So when you've got all these terms and everybody's perception of what this new study says, you're not only trying to get out your message, but you're trying to remessage your message to combat any information or disinformation that's coming your way. So social media really, and armchair epidemiologists, can certainly throw a wrench in some of your communication, make you think creatively and how to get your messaging out effectively and from a trustworthy source.
And we use students often during this. We would do push notifications. We would have students design posters and messages that helped other students really understand the importance of what we were saying. One of the things that often is the case in public health crises is that health disparities in some of our most vulnerable are exaggerated. And we certainly have seen that with COVID. When we offered on-campus vaccine or booster clinics, much of the misinformation that needed to be dispelled were with some of our campus community members of color. They were getting information from churches, from families that weren't always based on science. And we had to take a step back and recognize that this was the distrust of the government, the distrust of healthcare providers is real and quite frankly earned in many situations. And so we were attempting to use our messaging to reduce any health disparities within our campus community. And so sometimes the best person to talk to an individual was somebody who could offer the representation that I couldn't as I'm going to go with middle-aged white woman. My children would quickly tell me that I've passed middle age. So, but I'm going to stick with that identity. So we had to really get the message out in a way that people understood.
Yeah, and to couple that, I mean, certainly agree 100%, but looking beyond the campus, that not everybody has access to reliable internet, and so much is done through Facebook web pages, posting information, that realizing your community may not be where they go to get their information, like so many on this campus would be. So I know that was a challenge outside of this campus. Is great, we've got Facebook posts, great, we've got commercials on TV, but unfortunately, Wi-Fi and internet access is not something everybody has. A lot of people don't have access to that. So really looking at that systemic issue of access to information and how critical internet is.
Yeah, and access to care.
Yeah.
We have, we have, even though we're perceived as being filled with privileged students, We had individuals who didn't have transportation,
Mhm.
and we had to provide transportation. We had individuals
Mhm.
who, whose health coverage could have been handled in a different state, but it didn't transfer to Illinois. And so it is an issue that transcends this current pandemic that we in McLean County need to do better.
Mhm.
Oh, this one just tugs at me. Mental health needs must be addressed. The isolation, the depression, the anxiety, the absence of human connectedness was so pervasive and continues to be pervasive. We're seeing the long-term effects in our own counseling center. Last year, we had a 60% increase in students accessing counseling. And to date, we've already had another 52% increase. This mental health crisis, pandemic, isn't limited to our students. Our employees say the same. Faculty and staff are exhausted. The world has been on hold for 2 years. And we're certainly seeing some issues academically with students whose high school experiences were disrupted, and they're coming to college less prepared academically and wounded, if not broken, because of some of the mental health needs that haven't been addressed. And so when we talk about telehealth or telecounseling, the pandemic helped many people pivot to an electronic form of getting some assistance, but it also highlighted the shortages in healthcare providers, not just in our region, but nationally and internationally.
Yeah, I have nothing to add to that. Yeah.
Mental health happens to be my area of specialty, and we could spend days talking about that. I want to talk about lesson 9 in terms of this doesn't have to be a polar issue. Part of the things we saw in McLean County and in Bloomington Normal is the divisiveness between keep my business open and don't force physical distancing, don't force mask wearing. And again, we could have done better in terms of elevating small business needs. I think, Carl might be able to add some things here in terms of the money that was infused into our campus community and into our Bloomington Normal community was helpful and was essential, but wasn't enough.
Yeah, I think the economic impact and the needs of the public health can both be true and both be elevated to equal importance, and trying to identify where's that Venn diagram of overlap that we can meet the needs of both, or maybe not meet the needs of both, but do what we can to address those issues. Unfortunately, COVID just shone light on a lot of, sunlight is the great disinfectant, if you will. There's a lot of systems that were broken before COVID that it got pushed to the surface when COVID hit.
Agreed. And our 10th lesson is our lives will never be the same. We will be forever changed. And the question becomes, are there elements that we've experienced collectively that we can use to go forward and to be better stewards of public health in our communities, and quite frankly, better humans in terms of how we take this challenging 2-year period and reevaluate priorities, think about what we could do differently. Here on our campus, for example, beyond this recognition that we need to address health disparities and we need to think about mental health. It's interesting. This week we're seeing adult respiratory issues come back with a flurry. I was just at the hospital earlier this morning. We have adult RSV. We have, influenza B is coming back with such vengeance, and as are those of us who are vaccinated or up to date. as our immunity wanes and now the masks come off and we're now exposed to lots of different organisms, we're going to tumble in terms of physical health.
Yeah, I think we're at a really critical point in the timeline of post-COVID, that now's the time to really
That's
commit.
really encouraging post-COVID.
Well,
yeah,
I
yeah.
I probably shouldn't say that, but
You're an optimist.
I'm
I
an
like
optimist.
that. Yeah.
I think we're at a really pivotal time to really assess moving forward and what lessons did we learn so we don't repeat them again, because there will be another pandemic. It's not a matter of if, it's a matter of when. And really, let's not fail our future selves in repeating mistakes. Let's take the time now to buy in all together to change what we need to change, so that when it hits again, we're better prepared, we're more flexible, not just individually, but at your job, globally, and all sorts of different capacities.
Sure.
So,
and this slide is perfectly and deliberately incomplete.
Yes.
We just put a couple of ideas up here that may stimulate some conversation. You want to start?
Yeah, so some of the lessons still to be learned, and I think that are obviously still being talked about, is ventilation and how ventilation plays into the transmission of COVID-19. There's a lot of research and a lot being looked at in terms of ventilation, and if you have a well-ventilated space, does that exchange your air enough that maybe you can sit in an academic setting when there is a spike in your community? And really, what is the infrastructure to ensure that your schools and workplaces are well ventilated? Vaccine equity, both locally and globally. We have to remember that, COVID just doesn't happen in our Bloomington Normal, just in Illinois and the US. We have to ensure we have vaccine equity everywhere in the world. Otherwise, we're just one variant away from the next spike. So
yeah. And so, we were fortunate that a lot of work had already occurred with mRNA technology. That's what allowed our the vaccines that were authorized and then approved to move so quickly. It wasn't as if we were starting from scratch. But we do need to think about and plan for the next variant, the next pandemic. And so we have some important lessons to take away from this experience. And, we're of course watching the surge right now in Europe. And it is real. And as a nation, we've lagged behind Europe in terms of our own patterns. There could be a full fury that is just around the corner. It's difficult to predict. We were going to put a forecasting slide in here and decided that it would be obsolete tomorrow because things are constantly evolving. And so we're gonna post up here our contact information, and then we're gonna stop sharing our slides because we want to hear from you. We want to hear what questions you have about lessons you learned or lessons to think about. These are our email addresses at Illinois Wesleyan. We invite you to stay in touch with us, to ask questions of us, and we're looking forward to a great conversation.
Thank you, Melissa. Thank you, Vickie. We do have a question in the chat, and it asks you to elaborate about COVID-19 socialization efforts for the African American community.
Yeah, I'm reading the chat as well. So thank you for that question. Tell me socialization efforts in our own community. Do you know, Carl, in terms of the context of the question? I
don't know, but Dr. Carla, I know you're on, and if you wanted to put in the chat, or if you raise your hand, we can unmute you and you could speak directly.
Good afternoon, everyone. Good afternoon.
Good afternoon.
And thank you guys for an excellent presentation. You know, I think the NAACP has found that different communication methods impact different populations, specifically for African Americans. So whether it's socializing messages on radio stations, through commercials, through our African American churches, how creative are we being to make sure the African American community is not disenfranchised, but is also receiving all of the accurate information as related to this pandemic? Thank you.
Your question is so poignant, and we found it necessary in our own small microcosm to do some of that outreach as well. So I, for example, in the School of Nursing, am blessed to have two African American faculty colleagues. And one of the things that we did as a health service is not that they could speak for an entire group, but we continued to stay connected to what they were hearing, because it was often common for a student of color to come into one of their offices and talk through what their trepidation was. And many of our students particularly were waiting to see what our faculty and staff of color were going to do about their own immunization status, what they were choosing, what they would do. So that individualized messaging is so critical. I will say that both for our students of color and some of our more conservative students, their place of worship was a tremendous ally in getting accurate, scientifically based information. And quite frankly, Dr. Carla, I lost track of the number of aunties and others in families that I talked to because they were concerned about about things like vaccines that were coming from a government that they did not trust.
Yeah,
Absolutely.
Sorry.
Oh, no, I was just going to say, you're right on point. And my final comment, I remember when the pandemic first occurred, we had the first vaccine clinic at Mount Pisgah that was geared towards our African American constituents, because there is that distrust, right? We can go back and historically speaking, we can come up with many exemplars as to why that distrust was there. So thank you guys for recognizing that. Very good job today.
Thank you.
If there are any questions that people have, you want to put them in the chat or raise your hand like Dr. Carla did, and we get those answered for you.
I have to, while we're waiting for more questions, I will say, in addition to having no shame and stealing Melissa from the health department in McLean County has been a tremendous partner with us. There was not a single day in which we couldn't pick up the phone and get an answer, get some additional resources. I was delighted that we could step up and do our own contact tracing. That allowed our health department to focus on the individuals that didn't have the same affinity groups that we had on our campus community. So I think our leadership was strong in our own city. I won't make this a political commentary, but I will say that we were fortunate in the state of Illinois to have some of our elected leaders not cave to some of the pressures that they were feeling, because they were able to use the science to elevate this public health emergency. So, I think about all the places I could have lived during this pandemic. Now, of course, isolated island would have been lovely on certain nights, but I was so thrilled that I lived in the Bloomington Normal community and had the partnership that we had. When we did on-campus vaccine clinics, it was our McLean County Health Department that helped us organize those. And so I just want to say that we really worked effectively in tandem to mitigate the risk and to keep our campus community strong.
Okay, well, Vickie, Melissa, thank you so much again for your presentation today. And also encourage anyone who may have a lingering question that you have both Melissa and Vickie's email, so you could reach out to them and ask them questions directly. So thank you both again for being here today. And I'll turn it over to Jeff Woodard for some closing remarks. Jeff?
Thank you, Carl. And thank you, Dr. Folse and Melissa. I really applaud your efforts because, I mean, certainly there's some lessons learned here. And what stood out with me was like the student engagement. And I can imagine how tough that was. Weekly testing, surveillance testing, and that. Yeah, we really appreciate you sharing that with us today. And of course, we want to thank Carl and of course, Tori Moray, who is our hidden technician back there who saves the day for us as always. I just want to remind you, I put in the chat for next month. I think I can get that in here if you can see it. Yes, on Thursday, May 12th, we invite you again to join the museum at Illinois Wesleyan University for the final Zoom Lunch and Learn of the season, when we will explore the new university-based innovation center and making a difference. And let's see if there's anything else I want to mention here. Again, certainly, like I said, communication is the key. I really appreciate Dr. Campbell, your insight as well, because we have to keep talking to each other, right, in order to make this whole thing work and destroy those myths that are out there about a very serious subject. So with that, continue to be vigilant. Have a safe and joyous holiday weekend, and we'll see you back here next month.
Great. Thanks, Jeff. Bye. Thank you.
Thank you. Bye.